Hey, welcome to another episode of Your Faith and Health Community. I'm your host, Pastor Jackie Jackson, and as always, on behalf of myself and our producer, Anita Alexander, we want to thank you very much for taking time out to spend with us today. And we hope that we give you some, let me change that. I know we're going to give you some information that will improve your quality of life. We have Marjorie Moseley, who is going to talk to us. She's working with Resolute, which is a certified navigator company, organization. In other words, they help you get enrolled in health care so that your hospital bills don't cause you to go into bankruptcy. That's not the only reason, but that's one good reason. Marjorie, thank you for being here.
Thank you for inviting me, and thank you for allowing me to talk about the Affordable Care Act and the things that are still in place for people and helping them to get back on track.
I know that when I worked with Enroll, and even now, because when I was with the outreach team, I would often talk to people about health care if they had it, because, you know, with the trauma of gun violence, that there were times where people did need to be able to see someone, and whether or not they had insurance that could cover mental health and stuff of that nature. And I found asking this question, do you have health care? And I would often get people say, no, I don't have health care, but I have Buckeye, Molina, CareSource, Parliament, United Healthcare. So it seems to be some confusion around health care or Medicaid when you're speaking of these companies. So it's like people will go, I have CareSource, but for some reason not realizing they have Medicaid.
That is true. So, but that's a good thing that they do know who their care provider is. And it's just the fact that we need to educate them. So if you're asking someone that and they say that they have one of those providers, you're like, well, you have health care.
Right.
You got Medicaid. Does that come from Jobs and Family Services? Have you talked to them? Is that how your paperwork came? Is that how your paperwork came for you to renew what you have? And if they say yes, then yeah, you have Medicaid.
Now, are there two different processes, right? Is there one process, or I know at least at one point it was, where you have Medicaid that you have to recertify, or not recertify, that you get?
So every year you do have to, I'm not saying reapply, but it is a certification that validates you meet the income guidelines for you to continue with the Medicaid. At that time, it'll give you a recertification date or a re-enrollment date, and you need to get that information back in. It's as simple as making a phone call. Sometimes you may have the ability to go online. Whatever works for you that makes it happen. I don't want to tell people the only way you can do it is go and be online. That may not work for you. You may not have a computer. You may not have the internet. You know, all those things play a role in what you may be able to do. But if you have a cell phone, you can always make a phone call.
Always make a phone. Can we call Marjorie?
Yeah.
You can call Marjorie. Right. So I know I'm jumping around a little bit.
But you can. We can go back and re-enroll you too.
Okay.
Yeah.
So it's like, it's not, you help them and then you disappear into the abyss. You're always there. Marjorie Resolute is always there.
We're there to be of assistance to the community and the members of the community, making sure that they are taking care of their health needs. I always tell people, I don't need no health care. I said, but doesn't somebody love you? And when you say it like that and they go, yeah, somebody loves, then they want you to be healthy.
If you don't do it for yourself,
do it for them.
Do it for some. If you don't do it for yourself, do it for people you love.
Yeah.
Now, I know I'm kind of jumping around like
That's
a cat
okay.
on a hot tin roof. Don't know where that came from.
But I understand.
Yeah. I want to talk about, or not really talk about, but just clear up some things where COBRA is concerned. And what I do like about this interview with you is that I think it's giving people an opportunity to get some good information, but also to clear up some myths, right? It's kind of like that thing of reviewing what you think you know in terms of getting health care or Medicaid, well, health care is Medicaid, getting Marketplace or Medicaid, getting health care and getting covered. COBRA. So, you know, I'm working, I lose my job, and they say, hey, Jackie, you can get COBRA. And I'm hyped because I'm thinking I won't lose insurance until I go to COBRA and see how much it's going to cost. But what are the steps of getting COBRA, or not getting COBRA, because that's not what you do. But I believe that there's something that if I get COBRA after I leave my job and then realize that that $700, $800, $900 a month is too much to pay, can I call up you now and talk to you and you help me navigate through the Marketplace?
You generally won't be able to get a Marketplace plan once you have enrolled into COBRA.
So let me be sure I'm right. My job says, hey, here's an alternative, we're letting you go, but here's something that you could do.
You won't get a special enrollment. You can't enroll into the Marketplace. You would have to wait till the open enrollment period to enroll into the Marketplace. So this is what we would say, or this is what I would say, if somebody called me. I have this option of getting COBRA, but the COBRA cost for me and my family is going to be $1,200 a month. That's an example. Then I would say, let us just look at the Marketplace and see what's available to you. And then I might say, so now that you are unemployed, what is your income? And if they meet the income guideline for a family of 4, which is $36,156, they're eligible for Medicaid. If they have children, we still have CHIP in the state of Ohio. That's is the Children's Health Plan. So we would look at all these options and let then the consumer make the decision, not pushing them one way or the other, but giving them information so they can decide what best meets their needs. A lot of times the consumer, their children are asthmatic or, they've got other pre-existing conditions. And so it is necessary for them to find something because your child needs the medicine. And so we want to make sure that we're providing them with good information so that they can make the best possible decision for themselves and their family.
So it's not deterring because
it's just helpful.
I may just be happy with paying the $1,200 a month and go, but you're there. Resolute is there to navigate, to guide people, not to promote or persuade, but to say here are your 3 options, the pros and cons of each, and now let's talk about them and then figure out what works best for you. Because at the end, the consumer is the one that's going to make the decision.
That's correct.
Anyway, right? Okay, cool. I just wanted to touch on that. Didn't have to stay. I want to go and talk about, because we talked about at the beginning, and at the beginning of the show, I always talk about something with healthcare and the life-changing events, recently being married. So let's talk about what these things are. And you mentioned it kind of at the beginning as well. But you want to just run through them again?
So, if you get married, you have a baby, you adopt a baby, you get a new job, you move to another city, another state, and there could be personal situations in your life that may give you the opportunity to have a special enrollment. And that way we can go into the system, put this information in, and then we know if you are eligible for a special enrollment.
Okay.
But losing a job, changing your household size, changing if you move out of state or whatever.
Been in the United States with a green card
Yes, if you've been
or a visa for
yeah,
less than 5 years.
yeah. So all of those things, and a lot of people are like, what are getting? No, they are contributors to society, and we need to be very careful about that. There are guidelines that are set up that are followed by the federal government that we must adhere to.
And one thing I want to make sure that we mention too, recently been released from being incarcerated.
They may be eligible for Medicaid. And I don't know if we went to the institutions, but I know Ryan and I did when we worked together. And we went to, but we did too.
We went up to Warren.
Right.
We went to Warren a couple of times.
And Marion and some other places.
Yeah.
But they are eligible for Medicaid. And currently now we can't get in.
Right.
Because of the current crisis that we're engaged in.
But if they're coming home, like so for instance, if you're watching or you know someone, you have a family member, son, daughter, friend, best friend, I don't know, neighbor, and they just recently been released from incarceration, they're eligible to enroll. Mm-hmm. So basically, being incarcerated does not make you ineligible for health care, whether it's Marketplace or Medicaid.
That's correct.
Right? Because sometimes people feel you're coming home, you think that, you don't know what you have, what you don't have, what's available. Mm-hmm. And you all will work with people with that. Turning 26.
So, you just turned 26 and you're no longer on your parents' health insurance. You may be eligible for Medicaid. If you're going to college, you may be eligible for Medicaid and taking that with you.
What makes me, because I hear you and you're saying with each you may be, what makes me ineligible?
We have to put in the information and the system will tell us. But 9 times out of 10, I have not seen anybody that did not get the Medicaid. Because really, they don't have any income.
Okay. So it's, but I understand you're saying.
Like they're working part-time, so they're probably not even making the guideline, so that makes them eligible.
But let me ask you this, because this happened to someone I know personally. Mm-hmm. They technically work part-time. Mm-hmm.
It's based upon the income.
For Kroger.
Mm-hmm.
But because of the pandemic and some other things, they are getting more hours,
right,
and more money,
right.
That whatever
and it may
bump,
take them
right?
off.
So they received a letter that they were no longer eligible for Medicaid.
So they can do one or two things. They can give us a call, and we can see based upon their income if we can go into the marketplace and find them a plan. But they have 60 days to get that done.
So, within that, I get this information, or I get this letter that I'm no longer eligible, but I'm still a part-time, wherever it is, Kroger,
whatever.
Big Lots, Billy's
Billy
Boo-Boo
Bob's.
Shop, or whatever. But I am a part-time employee. The fact that here and there, or because of special situation, I get more hours, that's not my regular employment. My regular employment is only
It's based
20
upon
hours.
status of income, and if your weekly income changes, that is going to trigger something with Jobs and Family Services. I kept saying Welfare Department, but it's Jobs and Family Services. And they are obligated to inform you within a timely fashion to notify you that you no longer have Medicaid. And your options are to contact someone to see if you can get into the marketplace. It may not cost you a whole lot. It might still be only $10 for that time period, but you got to find out. We can't tell you that. It's best to contact a navigator, because that way you don't get frustrated with going through the system because it can kick you out and you got to go back in, you got to start all over, you got to put the data in. If you don't remember your login and your password, then that's why we're here, because we're writing that stuff down. We're going to give that to you. We're not going to keep it. We're not going to utilize it. We're not going to invade your privacy in going back into it. That is your information.
Okay. You have, or not you have, but there is a checklist, right? The marketplace application checklist. Mm-hmm. Can we just talk about that for a minute?
We can. Let me pull it up because I don't know all of that by heart. And so let's go over it.
And just because I think it would be good for people who may be getting ready to go into the marketplace or considering it, to have an idea of what they need to be prepared for. So that way, if you go online and you got everything ready to go, and then you realize you don't have information that you need to have. Right. Now you got to go through all that or start over again or.
And you know, when we did Enrolled, remember how we used to call them and remind them of their appointment and everything they need to bring with them.
So that's why I think it would be good, if you don't mind, just kind of, and we can run through it. So what's on this checklist?
So it's going to talk about your household size. It's going to be the home or mailing address for everyone that is applying for coverage. Information about everyone.
I'm stopping for 1 second though. On the household size, figure out who in the household should apply. Mm-hmm. So just because I'm the head of the household or whatever, if I have somebody in the household that's working, I'm not going to be applying for marketplace to cover them, right?
You possibly could.
Oh.
Because it's going to ask you about the household income.
Okay.
So you got to have an address for everybody that's applying for coverage. Information about everyone that's applying, date of birth, social security number, so forth and so on.
Their green card or something? Because I remember when
if they're in their immigrant status, yeah.
Or because I know for some people, especially in the Latino community, where there may have been somebody in the house that wasn't registered, so nobody in the house would register for fear that would
trigger something,
would bring something. So every information on everyone applying for coverage.
That's correct.
Right? So if you're not trying to get coverage for grandma, you got to
if grandma's on Medicare, we don't need to be talking about her Medicare because it's totally a separate entity.
Cool beans. Social security number.
Documentation for the legal immigration status, you gotta have it. You've gotta have information on how you file your taxes. A lot of people will bring that information in, and it is extremely helpful.
What if I owe money?
Don't worry about it. That's not what our purpose is.
Okay. So so don't not apply for health insurance because you go, I owe Uncle Sam some money. You're not going to be denied because
we're not
you
Uncle
have a
Sam.
balance.
You know, we're not the ones that are coming to or sending you something with regards to that. Apply for your health insurance. Income status of everybody in the house. And sometimes you can estimate the income, but healthcare.gov will send you out some information to have you validate that income that you provide to us. Because if that income changes one way or the other, if it goes up, they're going to bill you. If it goes down, they're going to adjust. Okay? But you got to validate your income.
Before you move, just a quick question to that. So if I start out, I'm in the marketplace because I'm in that guide or meet that guideline to be in marketplace. But then in the middle of that period, I lose my job status. Can I maintain my marketplace insurance if I just still go ahead on and pay whatever that is each month, or I have to go to Medicaid?
You don't have to go to Medicaid if you don't want to.
Okay.
But they will look at your status, and if you do fall in those guidelines, they can say you're eligible for Medicaid, and you're like, oh no, I still want to keep my health insurance, blah, 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 and you keep your health insurance.
Okay.
You know, as long as you're making your payments to your provider each month or however you have it set up, you're good.
And you'll be able to help them navigate through that.
What I will be able to help them with is just the process. When it comes to the managed care providers, it's at that time that the consumer will address their needs and how they want to pay and how they want to be billed and so forth and so on with them.
Okay. I didn't mean to stop you.
That's okay. That's a good question.
Estimate your household income.
Mm-hmm. But like I said before, if you do that, healthcare.gov will send out information either online or hard copy, however you choose to be contacted, and they will say we need to validate your income.
Okay. Policy number for current health insurance plans.
So if you currently have a marketplace plan and say you want to go to a different plan, and this is only special enrollment, can you do that? Say your job has changed or your income has changed, so you want to adjust your marketplace process. So you got to have those policy numbers.
Which means you only have 60 days to make that change.
That's correct.
Okay.
And so they have that policy number, they can go in and verify it, and you say, well, I don't need that, I would like this, because this is my status now.
Okay.
And everybody, everybody that we have dealt with previously, my experience has been, the marketplace has been extremely helpful. I've been very fortunate that the people I've spoken with over the time period have been just some great folks and patient with everybody that comes on the phone. Or I say, look, I'm stuck, it keeps kicking me out. We need to get to the plan. Here's everything that we've done so far. And they'll talk to the consumer and get all the information verified and say, yep, it did kick you out, or it stopped you right there. Let us go ahead and proceed. And they'll verify who they have on the phone with us. Mm-hmm.
Okay. Employee coverage tool. It sounds like something from, I guess I can't say, but it sounds like something from one of the commercials.
So, every job-based plan has something that tells you how you're eligible for coverage. So, it will say you are eligible for this plan or you're eligible for this plan. So it gives you options of plans you're available for and what you want. And so that's what it is. It's a tool that lets you look at the plans prior to signing up so you can have an idea about what you might be interested in. And you don't have to commit. People think, oh, I'm doing this, No, you get to look. You get to talk about it. And you look at the pricing and see what it covers and what your premium cost is and what your out-of-pocket copay is. And if you have to go to a specialist and if you need a dental plan, and the eye doctor plan, it's all in there. It lets you know.
Now, if you come back, so I sit down with you today. We start looking, we've gone through all the checks and balances, bells and whistles, but we start looking at plans. And I'm not ready to make a commitment to a plan. So does that mean that now we start the whole process over when I come back next week?
You shouldn't have to start the whole process over because we've got to log in, you have a password, and we can go in and you say, I'm ready, I've made my decision. So we're going to proceed right on into the plan process. You select your plan. Information is verified on how you want to be contacted. A lot of people like their stuff hard copy, but you do what's best for you. I always tell people, do what's best for you, what works for you. And once you get it, all you got to do is follow the directions. If you have any questions, you call the provider and say something's not clear, so forth and so on, and they should assist you with it through their customer service line.
Well, how do I get, so I'm on the phone with you, we're going through everything, I've got my taxes, I've got my ducks and cats and pickles, but you need the information, don't you? So how am I getting that information to you? Or do you need the copy of the stuff? Do I need to get copies of my taxes and everything to you?
9 times out of 10, people will bring in a copy.
So they can still bring it to you?
Yeah.
So they, or they still have to
But on the
bring it?
phone, we're going to just verify.
Well, that's what I meant, by
Yeah.
phone. So if it's on the phone.
We're just going to verify what you tell us. Remember, this is healthcare.gov. They can validate it.
They'll be able to validate it?
They
Okay.
will validate it.
I wanted to know that. Before because we're getting close to the end, anything that we're missing that I don't know to ask, that you think is really important that people need to know?
I think what has happened since I haven't been on the ground and other folks have not been here, a lot of people have allowed their coverage to expire. And they thought they had health care. If you think you had it and you're not sure, give us a call. If you don't want to give us a call, then call Jobs and Family Services and see if your Medicaid is still in place. Use all of the resources that are available to you because we want you to be healthy.
Is there a way to check online? Because I know sometimes trying to call Job and Family Services sometimes could be, I've heard people sit on the phone for 2-3 hours just
It could be a bear. It could be difficult, but sometimes they have systems in place now that if you would like a call back, one of our representatives will call back. You are 19th in line. Give them the number
Okay,
where
so
you want them to call you back.
So you don't have to just sit there and
Yeah.
listen to the music.
I believe we can go into the application and look and see if you completed the application and was it totally completed. If the application wasn't totally completed, Jobs and Family Services is going to send you something and say something was
But
missing.
that could delay that.
That will
60
delay.
day. So,
It will.
So trying to make sure, I guess the first thing is to make sure all the ducks are in a row in the beginning,
And that's why you come
and that's why we
to
go
me
to you,
and allow me to assist you.
and you'll have that part together.
Right.
Real quick question, and not really to go in depth, because I know this is not necessarily your wheelhouse, maybe. There was something I thought that I saw, and I know you and I talked, and you was like, maybe what I thought I heard I didn't hear, that Medicaid was getting ready to be reduced, or?
No, it is not. So those cost guidelines will not impact the service of Medicaid. They will be administrative. So Medicaid has to stay in place the way that it was initiated through the government. So you just can't go in and change the services because you got a reduction, or we're going to do a cost reduction, or we're going to do some cuts. Those are administrative cuts
Gotcha.
for the state of Ohio. So Medicaid stays in place in the state of Ohio,
Okay.
which is great. You know, a lot of people don't understand how important that was to have that in our entire state, that folks can apply and have some form of assurance that if they need to get to a doctor, that they do have that.
All the time, all the work, all the hours, all the effort, and because you're dealing with the public every now and then,
Right.
now and then, some of the frustration and that make the work that you do. I know I've been around you for all these years, so I know that you don't just do this because it's a paycheck, because you can go make a paycheck somewhere else. You do this because there is definitely a passion. I give God glory for you for the work that you do. Pray that you can continue to do it and that you stay healthy. And listen, I hope you got, I'm gonna change that again. I know you got some information that is good, that is life-changing, that's gonna help you be able to navigate through whatever situation you're having as we deal with COVID-19.